Doc Talk, brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hi there and welcome to the show, Dr. Nelson.
Thanks.
It's great to have you here.
It's glad to be here.
You always bring great information and you do a lot of good work here in our Pet Health Center. And we were discussing earlier about primary care and what the Pet Health Center really is and what it does. And what are some of the things that you do on a day-to-day basis?
Yeah, so basically in the Pet Health Center, we're kind of like your family doctor. So we do primary care, which means we do wellness exams, make sure you're healthy, do vaccines if needed, do heartworm testing in dogs. We treat sick patients that come in, so minor wounds, vomiting, diarrhea, the whole gamut. So we're kind of like the first line defense in your pet's health.
Oh, that's great. And you get to teach students and the students learn how to become practitioners. And
that's our goal.
That's right. Well, tickled to death to have you. And we're going to talk about something that's a really important health issue in dogs and cats, and that's heartworms. And what exactly are we talking about with heartworms?
Okay, so heartworms are a parasite that are transmitted by mosquitoes. The mosquitoes carry the little babies, and they're microscopic. We can't see them with our eyes. But when that mosquito bites the dog, it infects the dog with that, and they grow up to become this. So this is an actual heart of a dog, and all these squiggly things in here are heartworms. So in the dog, they grow to be about 12 to 18 inches long. So these guys get really big. They live in the heart and the primary vessels that are going in and out of that heart. So basically kind of clog them up. So over time, we get heart disease, and we also get changes to the lungs. So it damages the lungs too. Untreated, a large number of dogs will die from their heartworm disease.
Wow. So is it in different dogs more prevalent? I mean, is it young dogs, old dogs?
No, it can be any dog. And we do see it in Kansas. The further south we move, you're going to see it even more because there's even more mosquitoes. So say in Florida, southern Texas, you get it in Louisiana, about 100% of those dogs, if they're exposed to mosquitoes, are going to get heartworm. Here we still see a large number of them. And so as you go further north, it might go down. But heartworm disease has been documented in dogs in all states of the United States.
So when we start to think about heartworms and primary care and things to that nature, is this something that when somebody's coming in for, say, annual checkup or something that we address or we discuss? Or
Yes, this is definitely things that we discuss when they come in for annual checkups. So if we start with a puppy, they're too young to do a test for heartworm. It takes about 6 months or so for heartworms to mature into this, and our test tests for the adults. So as little puppies, we just get them started right on heartworm preventive. We don't want them to pick it up. As they get older, then typically we do an annual test, sometimes more frequently depending if the medicines have been given correctly. So at least every year your dog should have a test for heartworms, and we do recommend they stay on preventive every month, all year round.
No, it's great information, and you've taken us up close to the break. I think it's really important that people, sometimes we get really busy in our day and we're worried about our cows and our horses. We need to get our dogs into the vet on an annual basis.
Yes, we do.
Great. Thanks for joining us today. We're watching Doc Talk, and we'll be back right after the break.
Doc Talk, brought to you by Kansas Pork Association, assisting producers and informing consumers.
Hi there and welcome back to Doc Talk. I'm Dr. Dan Thompson here from the College of Veterinary Medicine, and I'm joined by Dr. Susan Nelson, who is an associate professor in the Pet Health Center at the Veterinary Health Center here at the College of Veterinary Medicine at Kansas State University. We're discussing heartworms.
Yes.
Big problem.
Yes, they are.
And so when we start to think about, our dog or something like that, what are some of the things that you're going to tell people to watch for?
Okay, so
in case they might have heartworms and we slip up or
yeah, because it happens.
Not everything's 100%
Not everything's
preventable.
100%. So what signs do we watch for? So like we talked about before, these adult worms live in the heart. So we see a lot of symptoms that reflect problems with the heart. One of those could be exercise intolerance. So your dog that could go running with you a couple miles with no problems, all of a sudden starts lagging behind. It just can't go as long as it used to.
Maybe I have heartworms.
You may. There have been people who have had heartworms. It's rare though, so don't panic, people. So another thing would be coughing. So this affects the lungs as well as the heart, so we can have coughing from some different reasons with these guys.
Okay.
Very advanced heartworm disease, your dog's belly might start looking really big and distended, and yet you'll feel his backbone sticking out. So he's really a skinny dog with a big belly. So those are kind of the signs we look for, that exercise intolerance, coughing, and as they get more advanced, they might even faint or collapse, get that big distended belly.
So kind of some of the same symptoms that we see with congestive heart failure
Yes.
or heart failure in general. And so then when you start to see these signs, or when is it that a person needs to start thinking about, I better get my dog into the veterinarian?
Well, in the ideal situation, we want to start puppies off on their preventive right from about 8 weeks of age and get them going right away, so we can prevent them from ever contracting heartworm disease. There are several different medications we can use. There are pills that we can give. There are spot-on topical treatments that we can use. And the nice thing about a lot of these products too is besides addressing the heartworms, they cover some intestinal parasites, roundworms, hookworms, some of them cover whipworms and tapeworms also. There's a large variety out there. So you can get a lot of protection for your dog in a once-a-month administration of a tablet or the liquid besides just a heartworm prevention. So it's easy. Most of them are within most people's pocketbooks. Now, if this is an older dog, I'm going to say over 7 months of age, that has never been on heartworm prevention before, it's important that we test them first. Because if they do have heartworms, some of these preventives can be bad to give them to them. It's not that we can't give it, but we need to watch. There could be some bad side effects.
So don't just go in the store, buy a heartworm preventative and put your dog on it if it hasn't been on.
Yeah, and I may mention you can't just go into the store to buy the heartworm prevention, or you should not be able to. These drugs require prescription, so an authorization from your veterinarian to give, because we know there can be some problems with these, and we want to make sure they're on them consistently. If they're on heartworm prevention monthly as we give it, and as we direct it, we still recommend they get a yearly test, and there's several reasons for that. One, nothing is 100% perfect.
Right.
These are pretty good products, I will say, but nothing is 100%. And then life happens. Sometimes you forget, you're off by a couple of days, or maybe the dog went out in the yard and vomited within an hour or so after you gave the pill, so it may not have had its dose for that month, and you may be unaware of that. So we want to make sure if they do come down with heartworm while they're on preventive, we catch them as early as possible so we can treat them. Another reason is that there's warranties and guarantees. And
well, I think that's a great place to take a break. When we come back from Doc Talk, we'll continue our discussion with Dr. Sue Nelson.
Doc Talk, brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hi there and welcome back to Doc Talk. It's Dr. Dan Thompson and Dr. Susan Nelson. We're both from the College of Veterinary Medicine at Kansas State University, and we're discussing heartworms.
Yes, we are.
And as we went into break, we're talking about some of the warranties or some of the things about heartworm prevention.
Yeah.
And maybe you can elaborate a little bit more on that.
Yeah, so several of the companies have guarantees on their products that if your dog would come down with heartworm disease while they are taking their product, they will cover most and sometimes all the expenses of treatment. Now that being said, they're going to go back and review records and make sure that you have been purchasing heartworm enough product that every month it looks like that dog should have received its pill. We can't ever prove that the owners gave it, but we can look back in records and make sure that it was purchased in a timely fashion. Because if they do find a lapse or a break in the heartworm prevention, then their guarantees probably won't be covered. So annual testing is also part of their guarantee. So even if you do keep them on month round, like we recommend, they still recommend an annual test for them.
Cool. It's prevention is
the key.
Better than treatment. And, and so now, like we talked, so I see the clinical signs, I take my dog into the veterinarian and we get the diagnosis of heartworms. Right. Is there a treatment for it?
Yes, there is treatment available for dogs. So fortunately there is a treatment. It's kind of rigorous. It involves some injections. Luckily it goes in the muscle, but it can be very irritating. They can be sore for a few days, and that's the injection itself. This is potentially, sometimes dogs can die from treatment, because as these worms start to die, they break up into little pieces, float around in the lungs and those vessels in the lungs, and they can act kind of like a blood clot, except it's a clot of worm. And if they go to the heart or lungs, they can cause that clot clot can cause that pet to die,
Just
basically.
like the throwing a clot from another surgery.
So there are things we can do to try to minimize that from happening, like spreading out our treatment and staggering out the doses. So yes, there's treatment, and most dogs do well with it, and there's other medications we can add into it to try to minimize his chances of adverse effects. But it is hard on the dog, and it can be kind of expensive too.
Is it dependent on when we diagnose it, the success of treatment? Earlier the better?
Earlier is always better because there's less damage to the heart and lungs at that time. We talked earlier about sometimes these dogs come in with a bloated belly and a big belly. Those are very advanced cases of heartworm. In that case, we don't do that treatment right away. There's some other things that need to be done first, because we are very likely to cause great harm to a dog if we would treat them with that product right away.
Well, and then you start to think about the cost of prevention versus the cost of treatment.
Yeah, even the entire dog's life, paying for that cost of prevention and even the tests is still cheaper than treating them.
Yeah, and when we're starting to talk about some of the dogs that we have out on the ranches and that are really performance dogs.
They are.
The cardiac insufficiency just can't happen.
Yeah, they can't chase the cattle and herd like they used to, so it's important to keep them healthy.
Well, it's when we think about treatment, how long is the treatment process once you start?
Anywhere from probably, if we spread it out, 2 to 3 months you have to be really careful and strictly cage rest your pet. There's reasons for that your veterinarian can talk about, but that's a very important part of treatment is after we give those injections, they have to be kept very, very quiet. Typically about 6 months later, we test them and see if they're cleared.
Perfect. When we come back, Doc Talk, we're going to wrap up with Dr. Sue Nelson talking about heartworms. We're sure glad you joined us.
Doc Talk, brought to you by Kansas Pork Association, assisting producers and informing consumers.
Welcome back to Doc Talk. Dr. Dan Thompson here with Dr. Susan Nelson, and we're both from the College of Veterinary Medicine here at Kansas State University. Dr. Nelson works over in the Pet Health Center and sees a lot of primary cases, and we're talking about heartworms. And you know, we live in Kansas, and it snows.
Yes, it does.
And wintertime we don't have mosquitoes, so is it important that I keep my pet on the heartworm prevention year-round?
It is very important, especially in Kansas, because our climate is so unpredictable. Last year we had a really warm winter, and you know what? It's 77 today, and we're into November. And so it's hard to predict when those mosquitoes are going away. Plus, even though it might have froze like last night or some other night, there's what are called microclimates. So around your buildings, there's warm areas. Those mosquitoes still live. And so they're still going to be hanging around for several months past where you even think maybe they're not there. The other reason is a lot of these things do protect for intestinal parasites. They can pick those up in the soil all year round. So for any reason, even if you don't believe mosquitoes are there in the winter, they still get the intestinal parasites. It's a cheap dewormer.
Gotcha. Great information. And then our last subject to kind of touch on is any other pets we need to worry about?
Yeah, so the two that come to mind that people have more are cats and ferrets. Ferrets are very susceptible to heartworms, so there's prevention for those. So if any of you out there have ferrets, then talk to your veterinarian because they should be on prevention. And then cats can also get heartworm disease. It's not as common as the dogs, but they still get it. And the problem we have with cats is one, trying to get the diagnosis. Testing them is very tricky. It's hard to get it detected in cats. And then there is no treatment option for cats. We cannot treat them like we can a dog. But the good news is there is prevention. And so for cats, prevention is the key. So even if
sounds like it's the only option.
It is. And even if your cat is indoor only, and I'm putting that in quotes because a lot of our indoor only cats like sit out on the patio with their owners and things like that. And just a few weeks ago I had mosquitoes in my house buzzing around. So mosquitoes still come in. We do know that indoor only cats can also get heartworms. So indoor only, indoor, outdoor, and outdoor cats, they should all be on heartworm prevention.
Same with cats all year round?
All year round.
And why is it that the cats don't have a treatment?
They just don't respond well to the medication. Cats are not small dogs, and their body systems are differently, and the treatment can kill the cats often. So.
Another way to say that cats and dogs are
different. They are different. Yes, they are.
Any last thoughts on heartworms or things that, just kind of a summary of?
Yeah, I hear from a lot of clients that they just don't feel heartworms are a problem in our area, and yet When I was in practice in this area, we treated numbers of dogs. Here we don't see as many clients per day, but we still treat a fair amount of heartworm disease here. It is here. They get it, and so we need to have our dogs and cats on prevention, and our ferrets.
Great information. I just love it when you come on the show, and I really appreciate you taking the time. And thank you for watching Doc Talk. Remember, we want you to always work with your local practitioner. And if you'd like to know more about what Dr. Nelson and I do here at the College of Veterinary Medicine, you can find us on the web at www.vet.ksu.edu. I'm Dr. Dan Thompson from the College of Veterinary Medicine here at Kansas State University. You've been watching Doc Talk. I appreciate you watching the show, and we'll see you down the road.